I like that.
Good morning, everybody. Welcome. Happy Friday. It is 9 o'clock here at Central Florida Behavioral Hospital and in Eastern Standard Time Zone, and we welcome you. We're going to go ahead and get started. This is a virtual webinar training on the topic of 4 layers of community recovery from a pandemic. My name is Kove Berman, and I am the Director of Business Development and Community Outreach for Central Florida Behavioral Hospital, and I will be your host today for this webinar training. I want to welcome everybody who is joining us from near and far. Today we have 300 plus people joining for this workshop. People from all walks of life who share our mission here at Central Florida Behavioral Hospital, which is a mission of providing help and hope to our communities. We have mental health professionals joining, school counselors, law enforcement, community spiritual leaders and leaders of faith, and just regular folks like myself from all across Central Florida and beyond. Your joining us today really demonstrates the extraordinary desire for all of you to be prepared and to be able to provide mental health guidance and intervention as you encounter the needs of the folks the needs of all the people that are reeling from the emotional and economic fallout from this pandemic. And we're so happy to have Dwight help us to provide the education to the community to help you guide everybody as well. So this training is here today to help you, equip you to save lives. So to those of you who are new to our hospital, I just wanted to give you a really quick introduction because there's a lot of new folks here, and you know, with these webinars, we've really been able to touch a lot of people and provide a lot of training. So a lot of you may not be familiar. So we're Central Florida Behavioral Hospital. We're a 174-bed psych hospital that's across the street from SeaWorld. Some of you might be familiar. We provide inpatient and outpatient psychiatric services for children, adolescents, and adults, as well as mature adults for our communities. And we also have virtual services as well for our outpatient programs. Our goal, as is I'm sure most of yours, is to save lives and to end the stigma surrounding mental health. We regularly provide trainings like this one today. We have a few scheduled out into July also with Dwight, who's been helping us educate. And you can find those, the schedule for our trainings on our Facebook and on our webpage. So I would encourage everybody to follow us on our social media so that you're able to see and register for our trainings. And so with that being said, I'm going to go ahead and jump in. Just a couple of housekeeping items before we get started here that I'm going to run through. So today's webinar workshop is 1 hour long. That will include Q&A at the end of the presentation that Dwight will open up when he's ready. All participants are going to be muted during the webinar. We have quite a few people, so opening the phone lines would not be possible. Also, for questions, please use the Q&A and the chat function for questions. I'm going to be monitoring all the questions that come through, and I'll curate them for Dwight to answer at the end of the webinar. We'll answer as many as we can. This webinar is also being recorded and will be available on our webpage, on the Resources Center of our webpage. I've actually put that here on the slide. So if you go to our webpage, on the top, there's a bar there. If you click on Resources, it'll bring you over to all of the resources we have, and we're accumulating quite a few for COVID right now particularly. You'll see all of our past workshops there that have been recorded with Dwight, as well as this one. Hopefully we'll have that up for you by the beginning of next week onto the website, this recording. When the presentation ends, or if you exit Zoom before it ends, you will automatically receive a prompt in your web browser, and that prompt says that you are about to access an external website. You will be leaving Zoom to access an external URL in order to complete a brief evaluation of the webinar. So when you get that prompt, don't be alarmed. That's actually a prompt for the CEU survey that we have. That's a Google form. You'll go ahead and it'll bring you directly to that. You don't have to do anything. You just follow the prompt, and it'll take you to the survey to complete. Today's CEU is providing 1 CEU, 1 credit for everyone who is participating. We'll have that CEU credit up and posted within 30 days of this webinar. And then certificates of completion will be emailed to all attendees following the end of this webinar. And with that, I'm going to turn it over to Vicki Lewis, our CEO. Vicki will say a few words and introduce our speaker.
Good morning. With report yesterday of COVID numbers growing, we asked how will this once again affect us in our daily lives and in our community. We continue to educate on the impact this pandemic is causing, not only from a social and a financial, but also the psychological consequences. Dwight, just yesterday, one of our psychiatrists shared with me her deep concern that with every patient she is obtaining a psychiatric history from, they are voicing the stress and the impact of COVID-19 and what it is causing and having on them. We are bringing this series not to impose or incite fear, but to help us all stay abreast of the consequences of a pandemic and to assist us with tools on how to advance our communities through this and to survive. No, not just survive, but to thrive. Helping us with this and bringing the education is Dwight Bain. Dwight is the founder and the president of Life Work Groups and is a nationally certified counselor in practice since 1984. His primary focus is on solving crisis events with creative solutions. Dwight is a trusted media resource who has been interviewed on over 500 radio and television stations, as well as quoted in over 100 newspapers, websites, including the New York Times, Washington Post, Chicago Tribune, Atlantic Journal, Orlando Sentinel, Miami Herald, Newsday, Fox News Business, and MSNBC. It goes without saying Dwight is very, very qualified and is certainly a choice of ours in helping to help our community. So with that, Dwight, I again this morning turn it over to you.
Thank you, Vicki. And you know, the information that we're seeing is troubling. As you said, there are reports at this point in time that, let me open up that screen so everybody can see the title slate. And at this point, we'll go to full screen. There it is. COVID cases in Orange County are up. There's a global recession announced this week. And so today I'm going to be giving you a tremendous amount of information. Now, listen, I just need you to focus on the parts that apply to you in your leadership role. We're going to walk through the 4 layers of community recovery because that's our goal. We will survive this, and we will survive this better together because Normal died exactly 90 days ago. Normal died. This was on March the 11th at the local Publix here in Winter Park. And that was the aisle for paper towels and cleaning products and Clorox wipes. Everything changed. And when I think about everything changing, let me move over to there it is. Right? Here's what I want you to know. The latest research tells us that Americans are not doing well. We're going to look at how does this impact us, but also, more importantly, what we can do about it. Look at the quote. 1/3 of Americans reported recent symptoms of anxiety and depression since late April. It's a sign that along with all the sickness and the death, the social distancing restrictions, separation from families, the deteriorating economy, Americans are facing a severe mental health crisis. That's from the Census Bureau and the Center for Disease Control. And that information is 2 weeks old. We're on week 12 today, ladies and gentlemen, week 12. And so what you start to see, look at the graph, depression, anxiety are at record levels. But what happens when those two overlap? Restlessness, excessive worrying, agitation, and we're starting to see an incredible amount of violence. Where's it coming from? The pressure is building. And then, I know that there are people watching from around the country. Thanks for being part. I live in Central Florida. This is my hometown. This is where I grew up. And this is Saturday night. Tom Thierry, WFTV weather man, chief meteorologist. And as you can see, this is Saturday night. This is in southwest Orange County. This is literally a few miles from Central Florida Behavioral Hospital. Orlando experiencing tornadoes, multiple tornado touchdowns. What does that do to anxiety? What does it do to fear? It takes us over the edge. These are the psychological reactions according to federal government guidelines on pandemics. Let's take a look. Feelings of despair, doom, fear, helpless, numb. I've heard that from so many patients over the last 90 days. They can't think. Their decision-making ability is gone. And remember, you're just writing down, you're just mapping out what data you need in your leadership role. But let me give you a basic principle, and it's not on the slide. And the principle is this: in a time of major crisis, do not make a major decision. Un más tiempo, one more time. In a time of major crisis, don't make a major decision, because you'll make a decision out of impulsivity, out of looking for relief, instead of being able to think clearly. The prefrontal cortex, a part of our brain where we can think clearly in a pandemic, is gone. For some people, it's their appetite, sex drive, they're tired, and their body starts to wear out. Chronic headaches, back pain, joint pain, gastrointestinal distress. Now listen, these are the normal reactions in an abnormal situation. And the abnormal situation is we're in the longest pandemic in the history of our lifetime. 1918 was a little bit longer, but we're only 90 days into what is projected to be 18 months. Some people are crying. And I saw a mom, her son committed suicide a few weeks into the pandemic, and she just cried and rocked. Because that's what you do when your son commits suicide, because he didn't know what to do with losing his job. Some people are taking high risk. I've heard of people having affairs that would never think about that. Some people walking away from obligations or taking on huge obligations. Remember, you're not thinking clear in a crisis, but there's also a spiritual component. We talked about that a few weeks ago in this training series, equipping local clergy and faith leaders. Some people give up on what they believe. They lose faith. This is a picture some friends took near their cabin in Gatlinburg, Tennessee. November will be 3 years. It destroyed the cabin. As they were leaving, hundreds and hundreds of vacation homes were destroyed. And I want to give you a visual, even though that's in Gatlinburg. I want you to see that there's a slow burn. The psychological crisis. We're going to talk about that today and how to recover from it. Because the projection at this point in time is that COVID-19 and the crisis level may go on until 2022. You say, Dwight, that's 18 months from now. Exactly. Look at the quote. There are decades where nothing happens, and there are weeks where decades happen. And we are in that time, ladies and gentlemen. There's 4 stages. Number 1, numero uno, here we go. It's the planning and procedure stage. Planning and procedure. Because during a pandemic, and we'll be sending you some resources, some of the charts and graphs. You're welcome to take screenshots if you like during the presentation, if you're using a smartphone or a tablet where you can take. I put everything together today to give you tools. Listen, you will help people I will never meet. The purpose of this series, when Vicki Lewis and I talked about this, the first, I guess it was the second week of the pandemic, we're on week 12. How can we equip you? How can we equip our community? How can we give you tools? And so everything that you see is for you. You will help people we will never meet. And we want to give you the tools to do it because there are different stages and phases. The first part, planning and procedures, and you may have been behind the 8 ball. You may have not known, oh, there's a pandemic coming. Look at some of the guidelines we use for community recovery is to plan activities to deal with complexity, emergency planning. Planning helps people stay calm. And for many organizations, they were blindsided. And let me tell you, I'm one of them. I've been a counselor here in Central Florida over 30 years, leading a mental health clinic, helping individuals find hope in hard times, creating a path out of crisis, helping them manage major change. I didn't understand all the things that would be coming with the pandemic. We were learning as we went so that our patients would feel safe. Every hospital, every clinic, every facility has been doing the same. And the good news is we're recovering. We're learning from each other. Universal Studios opening up, SeaWorld right across the street from Central Florida Behavioral opening up. Walt Disney World's Magic Kingdom opens in a month. Hollywood Studios, Animal Kingdom, Epcot the following week. So we're going to build everything around a timeline. Because as of today, we are still in active disaster phase. There are 3 phases of a disaster. We're still in phase one. We're still in phase one. We have 2 more weeks in phase one. This is where there's continuous critical incident, life-threatening situations. We know the number of suicides at an all-time high here in Central Florida, domestic violence all-time high, child abuse all-time high. And when you start to look at alcoholism, drug addiction, opioid addiction, many people are still at survival level. If you look at the bottom bullet point, water, food, medical, safe housing, toilet paper. Who thought that toilet paper in a time like this would be very hard to come by? Clorox wipes, hand sanitizer, just trying to survive. A critical need for safety. That's active disaster phase. And many in our community, 400,000 unemployed. Unemployment nationally, about 14%. Unemployment in Central Florida, 28%. Central Florida is experiencing double the level of unemployment, with the theme park shut down, the convention center shut down, the airport, the timeshare industry. And so what does that mean? It means we're still in a disaster phase. And to be able to walk you through how to help, this is from the Department of Homeland Security. If you're a leader, and I think many of the people on the call, Gavi said, you're leaders of organizations. You're in a leadership position. You have influence in our community. So you're paying attention to core essential tasks for you, for your team. You're paying attention to your personnel. Look at scenario 1. In a pandemic, you anticipate a 25% reduction in workforce. And that's held pretty steady. Many organizations, about 20 to 25%, either because people have to stay home to care for aged loved ones or small children who are vulnerable to COVID-19 exposure, or companies that simply downsized. And now who's going to do the work? Scenario 2, and unfortunately that's what we're looking at now. The COVID cases in Central Florida have increased sharply. And why? Memorial Day. Remember, it takes 2 weeks. And this week we've seen a huge spike in Orange County because at Memorial Day, people that would not wear masks, they would not follow the guidelines from the Centers for Disease Control. I've given you the link at the top of the page from the Department of Homeland Security. Epidemic, pandemic is where you go at that government website, because it will walk you through, if you run an organization, what are the must-haves? What are the essential services? What is mission critical? Because in a time like this, there are many decisions to be made. And the decisions follow one key word, and the word is safety. Safety. We are in a time of major crisis. Thank you for taking time out of your Friday so I can give you tools and resources, the information that you need to make decisions, but everything flows through the primary filter of safety. When I'm making a safety decision, I then look at the 3 variables most leaders pay attention to in controlling: time, energy, and then resources like money, facilities, staff, being able to open safely. Many people working within the school system, there are certain limitations. Everything flows through safety, and then you look, do we have the time to make this decision? Do we have enough hours in the week to do this? Do I have the energy? We're on week 12. I don't know about you, but every morning I'm getting up 90 minutes before I need to be somewhere to practice self-care, exercise, prayer, meditation, reading, planning, mapping out the day. We're on week 12. Do you have the energy? Because we have another, I hate to tell you, things get worse before they get better. We have another 6 weeks of intensity. And then we'll go into the recovery phase. Recovery phase starts in July. That's 2 weeks from now. It will go through Christmas. The recovery phase, phase 2 of the disaster, we won't even be there for 2 weeks, but it's to manage the emotional pressure of complicated grief. We're already seeing that. Loss, the psychological surge of emotions. If you didn't have a chance to participate in the complicated grief webinar weeks ago, thankfully, Central Florida Behavioral Hospital has archived. You can click on that, and you'll get several hours of training of how to help people that are just completely numb and overwhelmed from complicated grief. They lost a family member. They can't go to the funeral. I've heard that so many times in the last 3 months. But in phase 2, finding and building supports, gathering available resources, structuring the return of former life patterns, routine, schedule. School will start back And just like in 1943, when Bing Crosby had the #1 song, I'll Be Home for Christmas, you can count on me. It was the most popular song in 1943 because there was a war. Friends, today there's a different war. Today there's a different war against an invisible enemy, a virus that can kill you and everyone you love. And we're fighting it the best way we can, but we are in war. And we'll be home for Christmas. Maybe we'll have Christmas in July, because some people will take the tools that we're giving you today and you'll implement those tools, because 1 to 1.5 years. Look at the pattern. This is from the federal government and tracking huge disaster events. There's pre-disaster. That would be February 2020. Impact zone, you'll see it on the screen. That's March 10, 2020. The World Health Organization says COVID-19 is a global pandemic. Everything starts to lock down. There's a heroic stage where we're seeing individuals step up, but you'll also see there's a disillusionment stage. All right, we're on the downside. The honeymoon stage is where everybody, we're going to get through this. That's April, May. We're in the middle of June. People are tired. And you'll see at the bottom, there are triggering events that can go on up to a year. And that's why we're giving you tools, resources, guidelines, because, friend, you are not in this alone. As we enter phase 2, we prepare for rebuilding phase 3. That's in January. It's a stair-step process. I wish I'd underline the words responsible choices. If you're taking notes, underline it. Responsible choices. Listen, the responsible choice, if you're exhausted and you're the leader, the responsible choice is to take a day off. I've heard this from a lot of people because I work with many first responders every single week. Oh, I can't take time off. I have to be there. Here's how it works. It's pretty simple. If you get exhausted, you will not make your best decision. You don't make a major decision in a time of major crisis. You won't like the results. Responsible choices, that's January. Continued wellness, and then family traditions will start back. Theme parks will decorate for Christmas, and they'll have a Christmas like no other, because people will feel safe. Remember I told you? Safety, security, a balanced lifestyle, finding a new job, finding predictable income. And my hope and my goal, and why you're an essential part of this, is deeper relational community connections. From mentally resilient individuals, we walked through the disaster together, because there's a disaster coming. The first phase of disaster on March 10, they told us that COVID-19 was a medical, physical condition that would overwhelm you. And they're right. We're 90 days in. The second wave, I'm not as worried about the second wave of cases, although those are on the rise here in Central Florida and across Florida. Florida is one of 4 states in the nation where COVID cases are rising. COVID cases are rising. It was in this morning's New York Times. And what does it mean? It means where we live, the second wave isn't just physical, it's psychological. I'm calling it a mental health tsunami. And there's a multiplier, right? In 90 days, here's what we've seen. The disease is global. The second wave, anxiety, panic, hoarding supplies. The third wave, lockdown, social isolation, depression, financial recession. The Global Economic Forum on Tuesday of this week said we are in a global recession. The stock market yesterday, lowest numbers, 4th lowest day in the history of the stock market. In the history of the stock market. And the lowest 2 days, oh yeah, those were in March. It's projected 25,000 small businesses inside of malls will close before Christmas. When you start to look at indicators like stimulus money and federal government having emergency funds to help, and thank God they did. Yesterday's New York Times reported all, A-L-L, all of that relief emergency rescue money will be gone by the second week of August. 2 months from now, there will be no government relief, none. Financial recession will go deep. Right now, we've seen funerals, loss of graduation, loss of normal. But look at the sixth wave, PTSD, complicated PTSD, complicated grief, suicide. When we look at the indicators of what are people feeling in March, panic, numbness. For people in recovery, they were still in recovery in March. Marriage and parenting issues in March. But by April, 2 months ago, self-harm, suicide, calls to suicide hotlines were up from 40 to 400%, depending on the zip code. Gambling addiction, sex addiction, pornography addiction, at record levels of addiction. Individuals worrying about panic, paranoia, fear. By May, drug and alcohol use in some counties, the highest that we've ever seen. Food addiction, eating addiction. For children, obsessing, hair picking, skin pulling. For many people in May, complicated grief over issues of God, where are you? What has been the common theme? Now that we're into the sixth emotional wave, anxiety, stress, sadness, anger, people feeling completely overwhelmed. But listen, you'll always miss what you're not trained to see. And I'm going to be giving you tools. And I know some of this information is hard, but since you'll always miss what you're not trained to see, during this pandemic, the mental health wave that we're seeing in study after study, you can manage that. You don't have to drown in that, but you do have to have some tools. 4 elements of rebuilding. 1, you need data. 2, you look at risk factors. Risk factors. The government lockdowns and curfews, we know elevated because people, some of them in frankly dangerous relationships, were locked up. The theme parks closed, convention center closed, all that. Unemployment levels right now, highest level since the Great Depression. It's still unknown if schools will open in August, 2.5 months from now. But what we do know is that the very dangerous issues of drugs, addictions, violence, these high levels, you can't get through it. You need partners. You need people to be able to come alongside, because the news as of Tuesday of this week is that together we have to help each other, because more and more businesses will go out of business. What does that mean? Well, it means that if you worked for a company that had health insurance and you could go to a counselor, you now have no health insurance because your company went bankrupt or they laid you off. So where do you go to get help for the panic and the pressure? How do you deal with the loss? For some people, they lost relationships. Some people lost material things, maybe a home, an apartment. Some people lost finances, the hope of retirement. Some people, they lost their identity because they used to have a job. They used to have a name on a business card that said, this is who I am, this is what I do. Some people, it's cultural. And it's so much hurt and pain because of issues of diversity in our country right now. Some people lost mobility. They can't travel. They can't go see their extended family. Many people are not from Orlando like me. But notice this, everybody lost the word normal. One of the tools Gavi will be sending you when you get the email follow-up is a tool of how do I rebuild normal? How do I rebuild that? Let's talk about it for a minute, because before COVID, 1 in 5 people had mental illness. Only 40% of those people ever received any form of mental health services. 1 in 25 pre-COVID, 1 in 25 lived, they just lived with it. Or their exhausted family lived with it. 50% will have a mental illness diagnosis in their lifetime, out of 100 people. Half. I want to educate you. I want to give you the tools. One of the resources from Health and Human Services, and we'll give you these links and things, by the way, or you can write them down, access them right now. Because when we look at mental health, we look at the dignity principle. We look at the fact that mental illness, listen, is an illness. We look at the caregiver principle, because the caregivers of somebody with mental illness, they're exhausted. We want people to have professional assistance. We want people to have treatment and medication. We want everybody to understand this is complex. And by the way, this data was pre-COVID. It was complex. With COVID, just put a multiplier, put an exponent of 2 or 3. But listen, the good news, there's a hope principle. We are going to get through this. We are going to survive, but you have to be educated about what is involved with mental illness. This is from the link that we'll send you from the U.S. Department of Health and Human Services. What does mental illness look like? Because if we do anything, let's get rid of the stigma. Let's help people understand. Here's what it looks like. In a few weeks, you'll receive information about it if you're on the email list. We're going to talk about the children of COVID and how to equip the children who are living through the longest period of crisis in our lifetime, and how to protect those children as they get ready to go back to school. Because when we start to look at the disaster attributes, forced isolation has elevated that 20% of people that are prone to mental illness anyway. And it may take years before we have actual data. We're only on week 12 today. Today begins week 12. Everybody's had disrupted lifestyle, disrupted supports. Everybody's had some degree of financial impact. For some, they've been waiting on unemployment since they were laid off. I talked to someone this week. They said, I don't know why the unemployment's not here, but my landlord keeps hounding me and harassing me. And yes, there are legal rights in a pandemic. It doesn't mean that landlords have to obey them, especially in dealing with minorities who sometimes are they're just not heard. And it's like they're in it alone, but they're not alone. They have you. The ongoing media coverage and the journalism, world, they have their job to do, but please take as much news as you need from the news media, no more. Because you can absolutely get so overwhelmed on bad news that you just can't function. But see the bottom one, helping profession unprepared? I've seen that in some parts of Florida because I'm a trainer and I add value to different groups. But we're doing everything we can on that bottom one. You will help people we will never meet. You will help people we will never meet. And so we are passionate about giving you tools, resources to give you today the timeline, what's coming next. A mental health crisis. And so we're going to remove the stigma. We're going to stabilize symptoms, reduce symptoms. We're going to return to stable functioning or just get them back to normal life. Because during the pandemic, these are the things that happen. Here's what we've seen. Now remember, we only have 12 weeks of data, but we see that more people are concerned about a family member catching the virus than they themselves catching the virus. 40% are negatively impacted by self-isolation. Almost half of people have not done well. And now as things start to unlock, 31% of increased consumption of alcohol. People with children younger than 18 are more likely, 30% more likely to be drinking more alcohol the last 90 days. And look at this. They're 25% more likely than those without children. But the people without children, they're still drinking too much and they're still using illegal drugs, 13% more than they were 6 months ago. 43% of people diagnosed with an anxiety disorder have less access to mental health than before the outbreak. 36% feel the quality of supports in their life has declined. That's with anxiety. The numbers for depression, they're similar. What does it mean? It means we're going to get tools and resources. This is a flow chart that my friend, Colonel Charles Wood, he retired from the United States Air Force. But he said, here's what happens in a crisis. And right now we're still in the crisis intervention phase. There's something called critical incident stress management, trained crisis responders, one-on-one crisis response, group crisis intervention, assisting individuals in crisis. There are a number of very specific skills on critical incident. Many counselors aren't trained in those, but some are. Well, what happens when things start to stabilize, when we get into phase 2 in July and August? Employee assistance programs will become an essential resource. Private individual counseling to those who can afford psychotherapy. Chaplains, clergy, and for some hospitalization, family supports, rehab facilities. Why? They're on overload. They're on overload. But what can we do? Do it with me. Take a breath. You take a breath and you help people prepare. There is a second wave. It's psychological. It's mental. It's here. It's here. We're going to prepare, and then we're going to listen and speak with compassion and respect. We're going to reduce social isolation. I want to give you the signs and the symptoms of mental illness. We're giving you mental health education and training through this series, and please plug into all of them or watch the ones that you may have missed, because I want you to know how to give support and compassion in such a way that we can start to talk about the story of resiliency. We can talk about recovery, because as we move forward, WFTV said there's been a spike in overdoses, Baker Acts, since March. We know that mental health professionals are on the forefront, and thank you. If you're a mental health professional, thank you. Thank you for what you do. Thank you for being on the journey. We're giving you tools because you're going to reach into a part of the community that we don't reach, but together we can make our community better. Because mental health professionals in every industry, and we're seeing a cry all across America, we need more mental health. Why? Because people are hurting. The research says there's a strong argument. The sooner we can to a traumatic event, to provide psychological first aid, to provide mental health recovery, the more we protect people so that they don't slide backward. Here's the process. When we're dealing with a mental health disaster, right? If it affects multiple facilities, think school shooting, workplace shooting, think a mall shooting. Okay, that's medium level. I know it's bad. Pulse was bad, but not everybody was impacted by Pulse. Maybe you were there, like me and so many of my friends. But many people across Central Florida had never been to South Orange Avenue. They didn't know what SoDo was. They thought it was soda. They didn't know South Downtown was changed forever because it didn't influence everybody across the region. Look at high impact, Orange Code. Right? This affects multiple organizations and staff at multiple facilities. This would be like anthrax, something that's more community-wide, but look at the critical. That's where we're at, by the way. It affects the life, the safety, the finances, the reputation, and operational impact to business, education, medical facilities across the entire community, yay, across the entire state, yay, across the entire country, yes, across the entire globe. We're at critical, and we will be at critical for months. But how about some good news? I know you've seen the sign everywhere, at least since the year 2000. Keep calm and carry on. Here's what you didn't know. Because you said, oh, that was about Great Britain during World War II, during the Blitzkrieg. Right, so far. Here's what you didn't know. By the way, that's Winston Churchill in the middle, observing a historic church that had been destroyed by the Blitzkrieg, the lightning attack from the Nazis. In 1939, in preparation for World War II, here's what the government did in Great Britain. They created a series of signs. Keep calm and carry on was one of three. And it was to raise the morale of the British public because they anticipated massive air attacks on all their major cities. They printed 2.45 million, 2.5 million copies of the posters. The Blitz did take place, but the poster wasn't displayed publicly, and nothing was really known about it. And when the bombing started, the posters didn't get distributed. Let me say that again. The poster didn't get distributed. The posters, the stacks of posters were rediscovered in 2000 at a bookstore outside of London. Now, everybody, you've seen it on coffee mugs, you've seen it everywhere, but it wasn't used during World War II. Why? Because when the bombing happened, they didn't keep calm and carry on because of the poster. They kept calm and carried on because it was the only option they had. You and I will take a breath. Do it with me. That opens up the prefrontal cortex. It allows you to think clearly. You and I will keep calm, and you and I will carry on. We don't have posters, but listen, we have each other. We're living through a time of trauma. The research says a trauma is a state of intense discomfort, stress resulting from memories of an extraordinary catastrophic experience which shattered the survivor's sense of invulnerability to harm. Everybody's feeling that. And it's magnified when it's sudden. That was March. It's magnified when you've lost loved ones. Most of us have. People have lost jobs, homes, cars. They've lost their children's school. They lost graduation, Mother's Day, Father's Day, Easter. When their coping skills, support system, and faith system have been challenged, when their culture feels like it's under attack, these things elevate trauma to 7 levels. Everybody with COVID has experienced level 1. 2, cumulative stress, we're all there. 3, exhaustion, depletion, I think many. Burnout happens after that. And then an acute stress disorder, this is where you start to see physical manifestations, the crushing headache, back pain, gastrointestinal distress, people feeling all sorts of physical maladies, which are normal in an abnormal situation. But you see, that will, 6 months from now, be called post-traumatic stress disorder, or complicated traumatic stress. See, if you were going through a divorce in February, your life is really magnified and worse right now. If you had financial problems and facing bankruptcy in January 2020, you may be at level 7. You may be self-destructive. Like one of the suicides where somebody said, I have no money. I have no reason to live. I'm going to lose everything. I'll control the one thing I can control. I'll take my own life. When my team worked at Ground Zero in New York City after the terrorist attacks, we heard stories of the jumpers, people that saw the jumpers, because the buildings didn't fall. They were well built. They didn't fall for almost an hour after being hit by the jetliner. The fuel and the fires weakened the steel. But during that 45 minutes, if you were above where a plane hit, you knew you were going to die. Cell phones worked. Some people called their loved ones, and some people took an office chair or a desk, broke a window because the smoke was so bad. And some people jumped. Why? At the 7th level, controlling the one thing you feel like you have control, I'll control how I die. Our community's feeling that at a higher level than they've ever felt before. We have to help them. This is a picture that was taken by one of the award-winning photographers for the Orlando Sentinel. This was at a prayer vigil after the Pulse massacre. The picture was front page news around the country, but the principle of what are you and I going to do? These are dangerous times. We're going to pay attention to what supports are immediate, nearby, practical. We're going to offer hope and help and support and resources and referral. It's why you're watching right now, because there's a condition called acute secondary stress. A teenager that would never wreck a car saying, Daddy, I wasn't texting and driving. I couldn't think. Acute secondary stress, people make impulsive decisions they would never make. Why? They're overwhelmed. Isaiah the prophet said, I heard the voice of the Lord saying, whom shall I send? And whom will go for us? Going into ancient Israel, a people that were hurting, decimated by war. Isaiah is brokenhearted. Who will go for us? And then I said, here am I. Send me, Lord. Send me. I'm a person of faith, and I believe that you and I were supposed to be on a timeline at this point in history so I can give you tools so you can help people that I don't know. Here am I. Send me. I don't want you to burn out. I want you to have the tools to be able to help. What do? We get people reconnected to social supports. John Milton, almost 500 years ago, wrote, no man is an island, no man stands alone. We need each other. We're going to talk openly about safety, helping people feel in control of their circumstances so they don't feel out of control and self-destructive. We're going to be talking a lot in the series about practical assistance to help people with basic needs. You can go to a website, orangecountyfl.net. Orange County FL stands for Orange County, Florida, but it's orangecountyfl.net/emergency safety. And you will find very specific resources right here in Central Florida. You may have seen Orange County, Florida, to individuals who qualified, providing $1,000 of assistance. It's a one-time grant, but Orange County, Florida, giving $1,000 grants. And you can go to orangecountyfl.net, emergency safety, and find out. There are resources in our county. I want you to know you're not going through this alone. We're going to get through this together. We're going to talk about resiliency. And listen, we're going to talk about life outside of COVID. You're allowed to go to your grandchild's birthday party. I went to my friend Pat Williams' birthday party and the driveway. We all drove past the house. There's a circular driveway for Pat's 80th birthday. Remember, we're going to open up some conversations. When you talk through it, you begin to heal through it. And we're going to model courage. Look at the bottom point. We survive better together when we're building resilience. And when I talk about courage, listen to the word encourage, because that's what I want you to have. I want you to be encouraged. Encourage, take the EN away. To encourage is to be able to say, you know what? I've got the courage. I think I can get through this. And you will. And you'll get through it better together. What I don't want to see is that you become depleted, waking up in the middle of the night, or that you're losing weight or gaining weight, or you're sick all the time. It's only been 90 days, and this is going on for 6 more months. If you feel hopeless, please reach out. Yesterday, twice, close friends of mine called to say, are you okay? That's called a check-in, check two. Let me say it again. Check-in, check two. Here's how it works. Find somebody you haven't heard from in a while that you might be a little worried about. And to check in means call and say, how you doing? To check two is do that twice a day. Check in, check two. When I look at people that have given up hobbies, no, go back to gardening, go back to your hobbies. If you feel the pressure to hold everything together for everybody else, I need you to remember, protect you first. Self-care, number one. Family and friend care. Well, I've got to take care of all my family. No, you got to take care of you first. And then your coworkers and then your community. If you don't put the oxygen mask on you first, the flight attendants say, you're not going to help anybody else. So what does your mental health survival kit look like? Well, you may go toilet paper and hand sanitizer and face masks and gloves. No, your mental health survival kit is self-care, sleep, keep your tank full. This is a long haul, friends. Meditation, exercise, prayer, life skills, watching TED Talks. 4x4 breathing means you count to 4, hold your breath, release it, count to 4, hold your breath. That's what Navy SEALs do. And it'll calm your prefrontal cortex. Reading, pets, training events just like this one. That's a mental health survival kit, not more toilet paper, but you're allowed to keep your routines. I know Starbucks announced this week, Starbucks said they will close 400 units, but if your coffee is your morning routine, stick to your routines. Routines will help you to heal faster. Maya Angelou, the poet laureate of the United States before she passed a few years ago, Oprah Winfrey's mentor. Maya said, I can be changed by what happens to me, but I refuse to be reduced by it. You and I are allowed to stand together in community with our community leaders because community is how we heal. Mother Teresa would often quote King Solomon, speak up for those who cannot speak for themselves, for the rights of all who are destitute. Speak up and judge fairly. Defend the rights of the poor and needy. Why? Because we're in this together. We help people stabilize. It's called the SAFE R method. Stabilize, acknowledge, facilitate, encourage, and then a person's at a recovery level, or they get referred. Referred to where? Maybe mental health, referred maybe to a hotline, referred maybe to an intensive outpatient group at Central Florida Behavioral Hospital, but you're not in this alone, and neither are the people that you care for. Remember when we started, we saw a forest fire? You know what happens after the fire? I'm so excited. My in-laws have a timeshare. My wife and I are going to Gatlinburg, Tennessee in September. And I know where my friend's cabin was. And they tell me, Dwight, things are growing again. They're growing. There's a really interesting book called Lost Connections by Johan Hari. And it's how can you solve mental health problems without medication, without individuals staying in counseling forever. He said, well, you go to the deeper problem. The deeper problem, the lost connection, is community. There's not enough psychotropic medication in the world to make up for caring relationships. You can go to counseling every single day of your life, but if you don't have healthy relationships, if you're not plugged into community, if you don't feel a sense of social connection, you're going to be lonely. We were never designed to live alone. Now, hospitals and medication and counseling, I work in that world. They're necessary. It's necessary, but it's necessary to get you strong, to plug back into healthy relationships, to have a job that matters. One of the upcoming trainings in this series is on redefining your career, finding a career of meaning. So many people are unemployed, but I guess that's weeks, maybe a month from now. We're going to talk about here's how you find meaning-filled work. Meaning-filled work is one of the ways to feel so positive you don't feel depressed because you're doing something that matters. This is a picture of a friend of mine, a chaplain, who worked on a different team than mine in New York City after the attacks. He said, where do you start to rebuild? In a community disaster, You have to have an entire community to recover. You pay attention to medical issues, safety issues, emotional issues, financial issues, legal issues, career. That's why we're going to talk about an entire training program just on meaning-filled work, because maybe you've been downsized or a friend or family member have. My son-in-law lost his job during the first month of COVID lockdown. My daughter's job was put on layoff and furlough, and she's still not employed. So many friends and family, but what if you use this time of having no career to find a better, not just a job, but a meaning-filled? It's so full of meaning. You're excited every day when you wake up. And can I tell you something personal? That's me. I've been excited about this weeks that I could pour into the research and spend several days pouring into every possible resource, because you see the bottom one? I think there's a spiritual side to this. And it's not the job of clergy. It's the job of everybody. It's the job of everybody to talk about hope. There's a Russian poet 100 years ago who said, the memory of over half a lifetime, like swiftly passing thunder, dies away. It is not the revolutions and upheavals that clear the road to a new and better day, but it's revelations, lavishness, and torments of somebody's soul inspired in a blaze. The poem is called After the Storm. You can read the full poem on Google. But you know what happens after the storm? The rainbow. When I said I spent hours, and you'll get some of the links, FEMA, the World Health Organization, the Department of Homeland Security, because these governmental organizations and global organizations talk about community resilience, long-term vulnerability, reduction risk, disaster resilience. Resilience means that we're stronger after the difficult time. The Centers for Disease Control has multiple pages on COVID recovery. Don't try to figure it out by yourself. But remember, one of your trusted sources, you can go to the local media. Eyewitness News, WFTV.com. You can just Google, and there are resources to help your family deal with pandemics. I know, because I wrote them. I wrote them to give them to you. Resources like that and many others, trainings like this, are at Central Florida Behavioral Hospital. Because Vicki Lewis said, when this started, we're going to step up and help our community heal. Thank you, Vicki. I don't know how to say thank you enough, because you and I, Gavi, the team, Kelly, we get to help people. We get to help people all across our community. We get to help make Central Florida a better place, because listen, this is from a blogger in Nashville. He said, conversations will not be canceled. Relationships will not be canceled. Love will not be canceled. Songs will not be canceled. Reading will not be canceled. Self-care will not be canceled. Hope will not be canceled. Why? Because we're going to lean into the good stuff that remains. He works with an organization called To Write Love on Her Arms that helps teenagers with cutting. Oh yeah, it started in a place called Central Florida. So what happens next? More crisis. My friend Tim Mercaldo is a pastor on Staten Island. He took this picture a few weeks before the terrorist attacks. He said, this would have been in August 2001. He said, Dwight, it was really weird. I'm glad I kept it. He said there was a storm rumbling in across the financial district of the lower part of Manhattan. And he said it was like a storm was coming. He said, but I still saw the flag. That's my security badge for Mayor Giuliani, who was so kind to our team during that time. A community came together to heal. I'm telling you, it'll get worse before it gets better, and we are going to get through it. We're going to get through it because we have friends and family and clergy and counselors and neighbors and doctors and hospitals. We have legal and financial support and support groups. We have partnerships with the media. The community will heal. One of the most famous Japanese poets, once the storm is over, you won't remember how you made it through. You won't remember how you managed to survive. You won't even be sure whether the storm is over. But watch this. When one thing is for certain, because that's Hurricane Charley. That's Friday the 13th, 2004, the aerial global satellite shot. One thing is for certain. When you come out of the storm, you won't be the same person that walked in. Why? There's 4 levels of community recovery. There's planning, procedures, there's risk and vulnerability, there's community connection, and there's available resources. Available resources, because breathe, do it with me. Breathe. COVID-19 will end, and you and I will laugh again. I don't know what day, but I want you to know you and I will laugh again. Central Florida will heal, and Central Florida will get it right. When the theme parks open, the convention center opens, when our community opens, when some of the things I just heard about, Vicki, I can't wait to tell you privately, when certain things open, the whole world will say, wow, look at Orlando. Look at Central Florida. They're launching men back into space. Life is not over. The storm is over, and we are stronger because one day not too long from now, we'll breathe and we'll laugh again. I'm part of a community partnership of saying, hey, put the oxygen mask on you first. Put the mask on you first. Take care of you. Why? Because we're going to get through this. We're going to breathe. We're going to laugh again. If you want to stay in touch, I'm involved in social media, all of that, and there's a website. But just go to the Central Florida Behavioral website. My mission in life, since I had a heart attack and God gave me a second chance. Oh, yeah, the heart attack? It was at a place called SeaWorld on a field trip with my son, getting ready to go to Afghanistan to work with troops and some firefighters at SeaWorld. Stabilized me and transported me to Dr. Phillips Hospital. I got a second chance across the street from where this is being broadcast. A second chance for a time just like this, because we're going to laugh again. And we're going to do it better because we're going to do it together. Gavi, I'll turn it back to you.
Dwight, thank you so much for that powerful training. And as I always say, you say it best when you say we're stronger together. You know, connection is everything right now, connecting to you and connecting to us as well. I'd like everybody who's on this call to please go to our Facebook, like and follow our page so that you can see what trainings we have. We do these educational trainings all of the time, whether it's on COVID or other related topics. We want you to be able to see them so that you can register and bring those trainings home to your community. So I encourage you, please follow us on our social media on Facebook and on LinkedIn. Dwight, we do have a couple of questions here. One question that we had here from Marie Prophet is, if the COVID cases are rising in Florida, would it make it worse if we were to reopen?
It's a really good question. Dr. Burks up at the Centers for Disease Control, you see her on TV. Dr. Burks, when asked that question on a private call, she told our team, our leadership team, practice the CDC protocols. Practice the protocols. It's almost impossible to be able to catch the coronavirus. So it will not make it more dangerous. We have to practice the protocols. If you follow the guidelines right now, the 6 feet, wear a mask, cough into your sleeve, the protocols will keep you safe. The secondary protocols, have a strong immune system. And how do you have a strong immune system? Don't be afraid. We help each other through it. Thanks. Next question, Gavi.
Yes, next question comes from Claudia Swanger. She's asking if there are other counties that are offering resources. I guess you had mentioned particular resources that we were going to provide for Orange County, and we have folks from all over the country even on this call, but particularly around the area in different counties here. Do we know of any other resources or websites people can go to find
Yes.
resources in their county?
Thank you, Claudia. When you receive the email follow-up, which I think will come out early next week, I will put in as many links as I have so that you can track down. I'll put in the national links, and then for Central Florida, I'll have my team, my research team, my research assistant that helps, and we're going to get you as many tools as possible. But one of the things you can do, because I'm learning every week too, is to be able to keep us posted on, hey, guess what, Gavi, here's something that I found. And it'll help people in Brevard County. Hey, here's something that I found in Marion County. And so being able to know, we're learning as we go. And when we learn, we share it because we're stronger together.
Thank you. All right, Dwight, that's all the questions that I have here for you. I'm going to turn it back over to Vicki, and thank you very much.
You're welcome, sir.
Thank you, everyone. Thank you, Dwight. First of all, we again so appreciate you and are so glad that we're affiliated with you and have you in our community. For everyone that's listening, we have Dwight that will be presenting again on June 26th. It's on career change, and I believe that one is actually 2 hours. So pass it along to anyone that you feel would benefit it. I think it's obvious that Dwight just each time just gives us information that just will help us advance in our recovery in the community. And thank you, Dwight, for what you do every day for helping this city and this community to become a better place. And we can all do it together. So with that, we'll say thank you, and we'll join you again on June 26th.